Hey guys, this time we'll be talking about the peroneal artery, also known as the fibular artery. The peroneal artery is an artery of the lateral and the posterior compartment of the leg, which is a part of the lower limb. So we'll be talking about this artery in multiple aspects. First of all, you need to know that this diagram, this is a posterior view of the leg, that this is a view of the back of the leg. Second thing you need to know is that this is the popliteus muscle, right, which is, although part of it is present in the popliteal fossa, is generally seen as a deep muscle of the back of the leg. So the peroneal artery or the fibular artery is a branch of the posterior tibial artery, which is the main artery of the back of the leg, right? The posterior tibial artery in turn is one of two terminal branches of the popliteal artery at the level of the lower border of the popliteus. So the fibular artery comes off from the posterior tibial artery about 2.5 centimeters below the level of the popliteus muscle. And then what does it do? After coming off the peroneal artery, it descends obliquely, as you can see, obliquely towards the fibula. This is the lateral side and this is the medial side, and the fibula is the lateral bone of the leg, right? And after reaching the fibula, it descends along the medial crest of the fibula, and I will be showing you where the medial crest is in a while. It descends along the medial crest of the fibula, quite like this. Now the relations aren't that important for this artery, but you should know that it is accompanied by the nerve to the flexor hallucis longus, below which it travels. Now the branches are of some importance, but before that we'll talk a bit about the relations. If you look over here, the peroneal artery basically passes behind the ankle joint. This is the posterior view, so keep in mind that even posterior to it, it passes behind the ankle joint and the inferior tibiofibular joint, and is basically medial to the peroneal tendons, which are over here. Here we have the peroneal brevis, and this is the peroneal longus, and it's basically medial to these. Now if we talk about the important branches, we have a perforating branch over here, which comes off the main artery 4 centimeters above the ankle. Now this artery is in certain cases seen to reinforce the dorsalis pedis artery of the dorsum of the foot, and in some scenarios is seen to actually replace the artery. The important thing is that this peroneal artery, it gives off the nutrient artery to the fibula, whereas, as we've already talked about, its mother branch, the posterior tibial artery, gives off the nutrient branch to the tibia. Another important branch is basically the communicating branch, with which it forms a arch 5 centimeters above the ankle. Then we talked about the posterior tibial artery giving off a medial malleolar branch, which anastomosed with other arteries over the medial malleolus. Similarly, the fibular artery gives off a lateral malleolar branch that makes anastomosis over the lateral malleolus, which is a part of the fibula. Similar to the posterior tibial artery, it also gives off lateral calcaneal branches, right? So these are all of the very important branches we have talked about. Interestingly, as I've mentioned previously, that this isn't just a branch, an artery of a single compartment, but both of the lateral and of the posterior. So it gives muscular branches to both of these. The communicating branch has been dealt with, so as the lateral perforating branch, my apologies, the large perforating branch, the lateral malleolar branches, and the calcanean branches. And the importance of the perforating artery, its significance needs to be kept in mind. Hopefully this was helpful. If it was, please like, subscribe, and leave a comment.